Hi guys, I'm Kellen, and today I thought I'd talk a little bit about my top surgery, double incision, and hip contouring experience with Mr Guy Sterne. So it's been 7 weeks now since my op, and I've just had my 6-week checkup appointment, and everything seems to be going really well so far. I thought it'd be cool to put something out there for anyone kind of looking for reviews and feedback on Sterne. I couldn't really find anything on YouTube or even just online anywhere much to do with Sterne. I think he's not as well known about as some of the other surgeons maybe, and I think that's kind of a shame because he seems like a really good surgeon and I think there's quite a few benefits with going with him. Like I said, I had double incision and hip lipo, which was basically just to straighten out my hips, I guess, to give me a more blocky V-shaped appearance, more masculine basically. For me, I'm not on T, so it was kind of, I didn't want my hip dysphoria to be the only reason why I was gonna choose to go on T, so that was quite important to me. Sterne is just, like, he's such a lovely guy, like no pun intended. He's super open, friendly and approachable. He was very open to me being, well, identifying as non-binary when I first had my consult with him. I'm kind of questioning that now. I'd kind of put myself as trans mask, maybe just trans, maybe a bit Enby. He was completely fine with me being non-binary and not on T and having top surgery. He's also really cool with me wanting to consider going no nips, and he's done that for a patient of his before, who just didn't want nipples. For me, I'm glad that I kept them. He basically was like, if you're umming and ahhing about it, I would suggest keeping them, because, you know, once they're gone, they're pretty gone, and you can always kind of tattoo in pigments later on. You can also, you know, kind of get them removed or revised if your nipple doesn't take too well. I'm really glad my nipples have turned out. I'm really pleased with them, and I think they look pretty good. I think Sterne generally gets good nipple results in that they look even. They look like cis guys' nipples. And yeah, to be honest, my nipple reveal at 7 days was like one of the most, it's just one of the best moments I think of my life. It was just really emotional, and yeah, I find them really like euphoric now actually. I just didn't want them to kind of protrude through shirts. That was kind of my worry when I was thinking about top surgery with, I guess, my chest before. I didn't want them to like stick out and people to read me as, I don't know, I guess a woman with sticky out nipples. That wasn't my vibe. But yeah, I don't know if you can make it out, but they don't really stick out. He's made them really small and really flat, so I'm happy with that. He doesn't use a binder or drains. So as soon as you're out of your op, you can literally like look down and see your chest, which is exactly what I did.
And immediately stopped crying.
But it's like amazing for recovery because you basically, there's nothing to worry about. You don't have like an itchy binder, there's no like drains to kind of get in the way, to like put places to like be painful when they remove, and you can shower as like straight from the get-go. He actually uses internal tissue glue, so he kind of like stands there and presses your chest to make sure the glue is like to your, so like your insides are tight. But yeah, basically then there's no space for seromas to build up. So apparently, according to some of the research, it's actually safer. It's a safer method than wearing a binder or relying on drains to kind of remove all the tissue, fluid and lymph and blood that could build up. One of the other pluses with Sterne is that his kind of timescale is like really short compared to definitely the NHS, like so much shorter. But even compared to other private surgeons where you'd be waiting, I don't know, like maybe up to a year, say, from initially emailing his PA, Jude. She replied within 24 hours. And then I had my consult literally a month after. So it was so fast. And then from my consult to actual surgery, I think it was about 3 months. And that's it. Maybe that's because he's like less well known. He's so specialist as well. He can kind of just do his own thing. He doesn't work with the NHS. Jude, his PA, and Kate, his secretary, I think, they were great. I had a lot of anxiety leading up to surgery. Not so much about the surgery itself. I was pretty chill about that actually, but more about the referral process and just whether it would actually happen or not.
I was literally so angsty.
So having them being really prompt really helped me. Sterne actually needs 2 letters. So one will be your kind of psychiatrist diagnosis for gender dysphoria and a referral. And his other one is just one from the GP. And there's kind of quite a lot of confusion over the GP one, but it's actually less of a referral and more of a letter saying that your GP knows what's going on. I don't know why Stone requires that, but I'm guessing it's probably so that they know if you did need to see a GP, I guess so they know you've got a GP that's still going to see you, and that isn't a transphobe, I guess. I don't know what to say much about the actual surgery day itself, just that it went really smoothly. It was pretty chill, actually. Everyone was really nice. I was kind of just playing on my phone for waiting around and watching the Olympics. The hospital itself is like really nice. It's a bit like staying in a hotel, just with more medical things around. The food is also pretty good. I had breakfast the day after, and yeah, I'd recommend you get croissants. But yeah, I didn't eat the day of, but they do give you dinner. I just wasn't hungry. I just couldn't eat the day of at all. But yeah, your food is all provided, your overnight stay is provided, and your medication is provided. So even the stuff that you might need to take home with you, like painkillers. They also give you compression garments. So you have these like super fashionable stockings to put on to prevent blood clots, and you keep those on for 10 days. I think I took them off around 7 just because they were kind of itchy, and I was like, if I'm gonna have a blood clot by now, I think I would have had one. I was also quite active, so yeah, don't worry. And obviously because I had hip lipo as well, I got given this like sexy compression short thing, which basically go from like knee to like lower rib area, and they just like compress everything for like 6 weeks. They have a slit so that you can go to the toilet without taking them off, which sounds bizarre and kind of freaked me out a bit, but it was actually pretty useful for like the first week. They were fine to use as well, it wasn't gross or anything. It cost 10 grand, 900 in total, and that's the top surgery itself is 7 grand, I think, 7 grand something. There's a £200 COVID fee at the moment just for PPE and your PCR test, which they do 3 days before your actual surgery. And then my hip lipo would have been about 5 grand on its own, but because it was added on, it reduced the cost a little bit. They do have a payment plan, so my surgery is being paid for over a 10-month-long interest-free medical loan through, it's called Chrysalis Finance, and they work with Ramsay Healthcare, which is the thing Stone is with. So if you're kind of worried about the cost of that, that's definitely something to look into. I should probably do a reveal. I'm gonna get stuck. So I'm still a little tight. I'm trying to stretch so we can get to this point comfortably. But yeah, here are my scars. I think Stone's done a really good job with the shape because I asked to have them straight across and then going up the sides here. They're still kind of crinkly, so I'm going to have to massage that out. And I'm really swollen still around this point. It has gone down though, to be fair. I was like quite swollen the first couple of weeks, but it's just gradually going down. Nipples are looking like nipples, which I'm really happy about. And yeah, they don't protrude, which I'm like really happy about. These parts here I had before my surgery. They used to be really bad. So they've kind of gotten less intense. I think they're slightly more flush now. Either my chest will settle out when things kind of relax into their natural shape, or I might consider getting them revised at some point. Begun massaging my scars after the checkup appointment. And yeah, I can raise my arms pretty well now. I've been told that I can get back to weight training, lifting weights. I jump rope, so I'm doing that now. Kind of feels a bit swollen when I jump, but it's fine. Oh yeah, and I can basically feel all this side of my chest and most of this side. It's a little bit. No, I can feel it now. It was a bit numb. I kind of can't feel through this nipple though, but I can definitely feel through this one, which is pretty insane for this stage because I think it generally takes, some people don't get it back and some people take like 7 years to get any sensation back. So I'm really happy about that because sensation is something that I do enjoy, and I was worried about losing that. That was like my one drawback, I guess, for getting top surgery. In terms of hips, I'll put a picture now up. But yeah, it can take 3 months or so to see the final effects with hips, just because they swell so much. So I'm still waiting for them to go down. I'm happy with my left side. My right side is kind of a bit more swollen and sore, I think. But fingers crossed, it will all look good in a few months. So I totally forgot to mention about my hospital, like anaesthesia, like the actual surgery itself. So yeah, basically when it was time for me to go down for my op, I was basically just chatting with the nurses and I didn't even realise that they'd put like the catheter in me because the anaesthesist, is that the word? Anaesthesist? Came into the room and we were just chatting about like hobbies and stuff. And yeah, the next thing I know, I'm like, this feels really weird. And it's kind of like your body just feels really like heavy, but also like your head's really light at the same time. Then literally the next thing you know, you're waking up. And I think the first thing I said was like, is it over? Like I expected them to just wake me up mid-surgery or something. I started crying when I saw my chest when I looked down. And the nurses were like, oh, are you in pain? And I was like, no, I'm just really happy. But yeah, from that point on, I was not on any pain meds apart from paracetamol. And the nurses were kind of like, are you sure your pain's not above like a 1? But honestly, like the pain after was very minimum. I was just like slightly tender when I kind of put pressure on my hips or kind of just moving my arms about. But yeah, I was quite nauseous when I came around, and I'd advise you to kind of ask for anti-nausea meds. I don't think I was high at any point, but I do remember being sorry, that's my cough. I do remember being kind of like pretty out of it to start with, and then I woke up as they were kind of taking stuff off. I think I came around quite quick, and then the ride back to my room was horrible because I just felt so motion sick. So yeah, definitely ask for anti-nausea in your meds through the catheter, or if not, as soon as you wake up. That's my pro tip. Okay, that was just my little add-on there. Anyway, thank you for listening to my spiel. I hope that helped somebody out there. I plan on maybe making some videos relating to kind of getting references, top surgery, prep, or like aftercare. what kind of stuff you might want to take with you to the hospital. Just some more existential topics, really. So yeah, that's it for now.